his leg.
I thought
As Health Watch, a nationally ranked junior cyclist, thought his knee pain was because of all the training.
But it was actually an aggressive cancer that threatened his ability to compete. CBS 2's Dr. Max Gomez tells us how an innovative treatment saved that boy's leg and then got him back on his bike.
That's right, and the treatment for this type of bone cancer used to be amputation. Then doctors developed chemotherapy that saved limbs and dramatically improved survival. But surgery to cut out the tumor was still needed, and that could crush Arnav Krishna's Olympic dreams. There are few sports as physically demanding and grueling as cycling, whether on the road or on the track. But it is Arnav Krishna's passion and love. As a nationally ranked junior cyclist, Arnav trained constantly, so it wasn't that concerning when he developed pain in his leg.
I thought, it might be just stretching pain to like working out too hard.
A couple of doctor visits and several scans later, the news was devastating. Arnav had osteosarcoma in his leg, an aggressive bone cancer right below his knee. His choices weren't great.
I could get an artificial knee and maybe not be as competitive in cycling, or I could get a totally reconstructed knee.
Arnav was referred to the Children's Hospital of Philadelphia, pioneers in limb-saving surgery, where doctors plotted a way to save Arnav's knee and his cycling. But first came intensive chemotherapy to shrink the tumor before surgery and improve his long-term survival.
There probably are microscopic pockets of osteosarcoma cells hiding in other places in his body. And so while the chemotherapy is important, it's also important to address the rest of him and make sure that if there are any lurking cells anywhere, that they are killed with the chemotherapy.
Then came tricky reconstructive surgery to cut out the cancer and save Arnav's knee. It required bone grafts, plates, screws, and taking live bone from his other leg.
He would have essentially a normal knee joint potentially and never need surgery again for the rest of his life. So that was the home run if we could get that to happen, but obviously we're going to be cutting closer to the cancer. So there's a little risk there.
It's been a year and a half since the surgery. There's no sign of the cancer, and Arnav is actually back training on his stationary bike with his dreams still in sight.
My dreams are to get to the Olympics. It'll be a long ride, but we'll see.
Now, Arnav had amazing support from friends, family, and his twin brother, who's also a ranked cyclist. Now, the Child Life program at Children's Hospital was also key in helping him through those long, difficult stretches of chemo. Arnav will be monitored for life for both his cancer and side effects of the chemo. But for now, it looks like he's, should pardon the expression, back on track.
Right? It's always nice to have that competition with your twin brother, though, right? To keep you going?
Yeah, that actually has got him going as well. That really does.
Thank you, Dr. Max.